Hi, I'm Dr. Lissa Rankin, and I wanted to give you a general overview about internal family systems, or IFS, as it relates particularly to medical and mental health symptoms. So, the science is clear that trauma leads to all kinds of different trauma symptoms, ways that we learn to survive and cope because of our trauma, but which could actually harm us or hurt others if that trauma is left untreated. The mental and physical health impacts that arise in response to distress or trauma can include things like gaining some weight, feeling some anxiety or depression, getting caught up in delusional, paranoid, or conspiratorial thinking, indulging in old addiction or starting a new one, experiencing some physical pain, or winding up with new or worsening medical health conditions, among other potential outcomes. While these kinds of symptoms can be scary or activate parts of us that try to shame you or change your behavior, understanding trauma and how it impacts your mental, physical, and spiritual health can help us realize that there's really nothing wrong with you. What if you're not defective or broken or acting out or a helpless victim of symptoms beyond your control? What if you're not in some way damaged or broken or acting out? What if your trauma symptoms are a natural and understandable reaction to hurtful experiences that you've developed coping strategies to adapt to? Wouldn't that be a revolutionary shift in perspective? Problem is that we live in a society and within a medical system that tends to pathologize, label, demonize, medicate, imprison, or even send to rehab every single trauma symptom that's deemed abnormal. This pathologizing model clearly isn't working. This doesn't mean that symptoms don't need treatment. They do. It also doesn't mean that there aren't real illnesses like COVID or cancer or schizophrenia, or that we don't need conventional medical approaches like vaccination to treat COVID or like surgery, chemotherapy, and radiation to treat cancer. We do. What I mean is that there's more than one way to treat these physical or mental health symptoms, and including a trauma-informed lens may actually improve outcomes and make it more likely that your trauma symptoms could improve. While symptom management is an important part of the medical system, our strategy for managing symptoms needs an overhaul. It needs to start by examining all these symptoms through a trauma-informed lens and learning to see how these symptoms may be paradoxically both harming us, but also helping us. Wouldn't it be a relief if you could simply let go of the idea that you're broken in some way? Imagine if you found a way to love, accept, and understand all aspects of your being, not just the parts of you that you like, but even the parts that annoy you, the parts that you struggle to get a handle on, the parts that might hurt you or hurt other people, and the parts that might be very fragile or vulnerable and pushed aside. Now imagine if you could apply that same kind of compassion with good boundaries to other people, especially the ones that you find hard to love. Just imagine how much better life could be. Such is the promise of a healing system that I spent many years studying in order to write about it in my books, Mind Over Medicine and Sacred Medicine. And that system is internal family systems, or IFS, which was developed by family therapist Dr. Richard Schwartz, who goes by Dick Schwartz. Before we dive into the IFS model, let me talk to the skeptics among you about what we know and don't know about childhood trauma and its impact on medical illness. If you doubt that trauma and disease are strongly linked and that trauma in childhood could lead to pediatric or adult onset disease, consider what California Surgeon General and pediatrician Nadine Burke-Harris said in her groundbreaking TED talk. She said in the mid-90s, the CDC and Kaiser Permanente discovered an exposure that dramatically increased the risk for 7 out of 10 of the leading causes of death in the United States. In high doses, it affects brain development, the immune system, hormonal systems, and even the way our DNA is read and transcribed. Folks who are exposed in very high doses have tripled the lifetime risk of heart disease and lung cancer, and a 20-year difference in life expectancy. And yet, doctors today are not trained in routine screening or treatment. Now, the exposure I'm talking about is not a pesticide or a packaging chemical. It's childhood trauma. She's referring to the landmark 1990 study of 17,421 patients conducted by Dr. Vince Felitti at Kaiser Permanente and Dr. Bob Anda at the United States Center for Disease Control, who collaborated on the ACE study, the Adverse Childhood Experiences study, which has resulted in over 70 peer-reviewed scientific articles. While some chronically ill patients might find this data disheartening, and I get how hard it can be to hear this, I share it because while it can be sad and scary, I also find this data to be hopeful. While we need more data to prove that treating trauma might reduce or even reverse symptoms or even cure certain diseases, anecdotally, the stories of seemingly miraculous remissions from disease that previously failed to respond to treatment, even things like cancer and heart disease, is growing by leaps and bounds. And I think that's really exciting. But before we begin to explore how treating trauma might impact physical and mental health symptoms, we have to break out of our collective denial that trauma and medical symptoms are directly linked. We have to stop thinking that every medical condition or mental health diagnosis is simply a chemical imbalance or a biomechanical breakdown that only medications or surgery could fix. We have to stop ignoring the reality that mental and physical health symptoms are often a side effect of psychological trauma, and that treating trauma with cutting edge trauma treatments like internal family systems and others could potentially improve mental and physical health symptoms, especially if they're related to parts of us that have learned to cope with the trauma through strategies that might get pathologized or labeled as illness. So, what do we mean by parts? Internal family systems is based on the idea that we are all made up of many uniquely autonomous, inherently valuable, well intended, but sometimes misguided parts. According to IFS, you are not a unified self. You are a multiplicity of parts. Or as Walt Whitman wrote in Song of Myself, do I contradict myself? Well, then I contradict myself. I am large. I contain multitudes. If you saw the brilliant children's Pixar movie Inside Out, you already have a taste of what IFS is all about. Inside this little girl's head, you see all the warring parts fighting to take over the control panel of the little girl's behavior. The girl's family has just moved her away from her childhood home and relocated her to San Francisco, and she is not happy about this. Anger wants to blow a gasket because San Francisco has ruined pizza by putting broccoli on it. Disgust wants to puke because her new school is just not all that. Sadness wants to cry because she's grieving all of her losses. Fear wants to hijack her because change is so scary. And bubbly cheerleader joy is trying to bully all the other emotions to try to fake a kind of inauthentic, toxic positivity. All of these parts and the little girl are duking it out for who will control the little girl's behavior. And surely all of us can relate to that kind of inner disharmony in times of great transition. The cornerstone of IFS is that in addition to all these parts inside, we also all have a wise, mature self. It's the part of us that's not a part, and every single one of you has a self, no matter how much trauma we might have endured. I spent many years calling this self my inner pilot light. And for many years, I made it a practice to wake up in the morning and let my inner pilot light write love letters to what I now understand as my parts. I collected these letters into a book called The Daily Flame because it turns out that our selves sound similar to one another. And the letters I was writing from myself to my parts really resonated with other people. Because when we're speaking from self, all of ourselves share the qualities of the 8 C's of self: curiosity, compassion, confidence, calmness, creativity, clarity, courage, and connectedness. They also share the 5 P's: presence, patience, perspective, persistence, and playfulness. So, who is this part that can heal your parts? The part that's not a part, or what Carl Jung calls the self with a capital S. Well, every spiritual tradition has a different name for it, but it's what I consider the divine inside. It's that one you've been waiting for, the inner healer, the inner doctor, the love that will never let you down once you attune to it, the mature adult self that resides within us all, the ideal parent that most of us didn't have, that can guide and mediate between the parts. And again, every single one of us has a self, and it cannot be broken no matter what you've been through. Mark Nepo describes the idea of self best, in my opinion, in Unlearning Our Way Back to God. He wrote, "Each person is born with an unencumbered spot, free of expectation and regret, free of ambition and embarrassment, free of fear and worry, an umbilical spot of grace where we were each first touched by God. It is this spot of grace that issues peace. Psychologists call this spot the psyche. Theologians call it the soul. Jung calls it the seat of the unconscious. Hindu masters call it Atman. Buddhists call it Dharma. Rilke calls it inwardness. Sufis call it Qalb. And Jesus calls it the center of our love. To know this spot of inwardness is to know who we are, not by surface markers of identity, not by where we work or what we wear or how we like to be addressed, but by feeling our place in relation to the infinite and by inhabiting it. This is a hard, lifelong task, for the nature of becoming is a constant filming over of where we begin, while the nature of being is a constant erosion of what is not essential. Each of us lives in the midst of this ongoing tension, growing tarnished or covered over, only to be worn back to that incorruptible spot of grace at our core. When the film is worn through, we have moments of enlightenment, moments of wholeness, moments of satori, as the Zen sages term it, moments of clear living when inner meets outer, moments of full integrity of being, moments of complete oneness. And whether the film is a veil of culture, of memory, of mental or religious training, of trauma or sophistication, the removal of that film and the restoration of that timeless spot of grace is the goal of all therapy and education. Regardless of subject matter, this is the only thing worth teaching, how to uncover that original center and how to live there once it is restored. We call the filming over a deadening of heart, and the process of return, whether brought about through suffering or love, is how we unlearn our way back to God. So the self is that aspect of our being that can heal your parts, but only if you stop pushing your parts away or hating them or pretending that they're not a part of you or trying to bully them into doing what other parts might want them to do. You can think of it like your internal family system of parts is populated with a whole busload of inner children. And if you're reasonably healthy, then what IFS calls your wise inner self is driving the bus, keeping the lovely but sometimes naughty, often boundary wounded, controlling, manipulative, submissive, unruly, scared, overprotective, and sometimes even reckless or addicted, dissociative, sociopathic, or even suicidal or violent parts from grabbing the wheel and hijacking the bus, making you do something you might later regret. You wouldn't want those little kids driving the bus. But remember, they're not bad or wrong just because they're noisy or acting out. They just need a grown-up in charge. And the grown-up that they need is you, or that aspect of you that's not a part, the self in you. This can feel confusing or even scary to some people to talk about having lots of parts inside. And that's because most of us grew up with the monomind paradigm, thinking that we are a unified self, and that only really mentally ill people, like the characters in dramatized movies like the 1976 movie Sybil or 1957's Three Faces of Eve, where they have multiple personalities inside. While people with what used to be called multiple personality disorder, and it's now called dissociative identity disorder or DID, have suffered more horrible traumas that most, and their personalities inside are more blown apart than most, they're not so different from the rest of us, and that we all have voices inside that talk to each other. We call it thinking. And if you've ever tried meditating, you may have heard it called the monkey mind. Why monkey mind? Because our thoughts are chattering away inside like little monkeys with endless commentaries about our to do lists, a string of worries and problems, a host of plans and fantasies, a laundry list of fears and catastrophizing, and voices that we often grow to hate, like the inner critic, the judge, or the perfectionist inside that tears us up when we make mistakes. If you don't think you have multiple personalities or multiple parts, just think of the last time you made a New Year's resolution or went on a diet or tried to give up a bad habit like smoking or convinced yourself you were going to finally muster up the discipline to do something hard like join a 12-step program, run a marathon, attend a silent meditation retreat, go to the gym to build a buff body, write a book, or get a graduate degree. Typically, one well intentioned, disciplined, health conscious inner critic part pushes us to make the New Year's resolution or do the good, hard thing. And then within a week or two, another freewheeling, troublemaking rebel part that likes to do the naughty thing that we're trying to stop comes in to tempt us to break our promises to ourselves or sabotage our goals. Given how few New Year's resolutions actually lead to real change, you'll understand that these parts tend to go to war with each other inside, creating a kind of like angel on one shoulder and devil on the other dynamic. Then, when those two start duking it out, yet another voice may come in to like beat us up and shame us for being weak or lame or undisciplined, and the cycle of self hatred continues. But who do you think is making and breaking those promises inside of you? It's clearly not a unified you, because if it was, you'd just do the good thing and never look back. Clearly, things are more complicated inside than our culture has led us to believe. Although it may sound disturbing to consider that you might have different personalities inside, going to war with one another, like one foot on the gas and one foot on the brakes, both motivating you to self improve, but also sabotaging your efforts to do so. It can also be quite a game changer once you realize that the monomind myth is false and that all of us, every single one of us, is made up of many personalities inside, which IFS calls parts. So, how could these parts possibly be helping you when they're wreaking havoc in your relationships or landing you in therapy, in the hospital, in rehab, or in extreme cases, maybe even in jail? We tend to like some parts, like the parts that balance the checkbook, the parts that try to keep us out of trouble, or the parts that are pleasing to others. But we dislike or are embarrassed by other parts, like parts that lose our temper, or binge drink, or get abusive with others, or beat ourselves up. Most of us don't realize that even parts like that think they're trying to help us because their main goal is to make sure we don't get overwhelmed by feelings that flare up from past traumas that may have gotten buried deep in our psyches and in our bodies, in our tissues, and they've never really gotten resolved. Those parts will do anything to make sure that you don't feel bad, that you can keep on keeping on, that you can function at your job or be a good parent to your kids or, you know, go about the daily details of your life. They don't, well, some of those parts don't care that you might wind up sick or taking psychiatric medications or addicted or hurting other people as long as they succeed in preventing you from feeling intolerable feelings. These parts don't realize that you actually can handle feeling the feelings from the past, as long as your wise, mature, divine self is present to help you manage those feelings. That's why in the IFS world, we say we're hope merchants for hopeless parts, because many of our parts have given up hope that they'll ever be able to heal from what happened in the past. They don't realize that suppressing our feelings is actually making life more difficult in the present, and that the way to deal with those feelings is actually to let them move through us in as safe a way as possible, rather than trying to stuff them down or suppress them or numb them or avoid them or distract ourselves with anything, even things like medical symptoms. So, the goal of IFS practice is to become intimate with all of our parts and figure out how they're trying to protect us. It's to gain self leadership over them, meaning that the self is leading the parts, so that we can uncover the wounded parts that carry burdens of painful feelings, sensations, memories, and beliefs, so we can heal those wounded parts and get those parts out of the past where they tend to be stuck. And so that we can mediate the differences between our parts the way a good mediator might negotiate between two people with conflict in the outer world. IFS aims to resolve all these inner polarizations between the angels on one shoulder and the devils on the other by befriending and healing all of our parts, by getting to know them and understand why they do what they do, even if they might be hurting us or hurting other people, without glorifying one part or demonizing another part, but by being really compassionate and curious about our parts and becoming intimate with them. So IFS is a practice, just like meditating or yoga are practices that you might do every day in order to heal, grow, and calm your nervous system. When we approach our parts inside as if there are no bad parts, only hurt parts, if we assume that even parts that might seem destructive really think they're trying to help us by making sure we don't feel intolerable feelings from past traumas, like helplessness, hopelessness, shame, terror, or sadness, then our parts can start to soften and they may relax their extreme self-destructive or hurtful behaviors. But in order to do this, in order to relax those parts that might be kind of sabotaging what other parts might want for our lives, we have to go through what we call in IFS unburdening, unburdening those really vulnerable, wounded parts, the parts that have been abused, shamed, terrorized, controlled, overpowered, disappointed, abandoned, and otherwise hurt in the past. To practice IFS, we have to start by getting to know all of our parts. And some of them are like hurt foster children. They may not trust us, they may not like us. And when I say us, I mean the self. When we in self go to get to know these parts, the parts may be very distrusting. They may not be willing to get close to us at first. But just like with a rescue animal or a foster child, if we're persistent and patient and we keep showing up, over time, we can earn the trust of our parts and develop relationships with them like they're their own little beings inside. And instead of avoiding them or pretending that they don't exist or burying them in our inner basements, we let them know we're sorry that we may have been doing that. We're really sincerely here now, and we really want to get to know these parts. And that's kind of how we start with IFS. So we've talked about how our internal family systems might be like a school bus of unruly children, hopefully with an adult at the wheel in self-leadership. And to use another metaphor, you might think of your internal family system as a family of parts sitting around a conference table, with your wise adult self acting as a sort of calm, collective, collaborative mediator, trying to negotiate between all the inner voices to come to some consensus about the choices that you'll make and the way that you'll handle problems, how you'll make decisions, and how you'll deal with the parts that might polarize against each other, like the part that might want to take the edge off at glass of wine or two after a tough day, and the part that thinks that you'd be better off abstaining. So you wouldn't just indulge one part and ignore the other. You'd talk to all parts involved that might have an opinion about having a glass of wine, like the part that wants you to lose weight, or the part that sounds like your Catholic grandmother who thought alcohol was the work of the devil and would get you sent to hell. And you'd listen generously to all the parts, and you'd get to know why they feel the way they do. You'd ask them how they think they're protecting you and what they're afraid would happen if they didn't do what they do and say what they say. And you can then remind all of your parts that you love them and you care for them, even the ones that sometimes do naughty things or get you in trouble. Sometimes you might have to intervene and apologize to the parts that get beat up by other parts, like you might do if you have two sibling children duking it out. Other times, you might have to lovingly discipline a part and set limits, like you would with children that might want to eat the whole cookie jar of Oreos. Just because a part wants to do something, it doesn't mean that yourself automatically indulges that part, but it also doesn't mean that it ignores it or shames it or demonizes it or pushes away its desires and needs or lets critical parts bully or judge or pathologize it. So once you get to know parts involved in making decisions, Then, after consulting with all relevant parts without judging, bullying, demonizing, or shaming any of them, then the mediator at the head of the table, your wise adult self, can help make a decision about how you're choosing to handle wine that night, just like the head of the family might help an external family system decide where everybody might want to go for a holiday. So, this conference table metaphor can be really helpful if you're stuck with a decision, you're sort of feeling trapped, like you're in a double bind, or you can't make up your mind, and you can just sort of go inside. It helps sometimes to close your eyes and just imagine a conference table inside. And you can ask, let's say there's I want to stay in my job, or I want to find a new job. I want to quit my job, or I want to continue in my job. You might just then go inside and just ask all of the parts that want you to keep your job to line up on one side of the table and introduce themselves. You might have a part that is worried about money. Great. So thank you. We'll bring in that financial part. You might have a part that really likes some aspects of your job and it doesn't want to lose those positive benefits of your job. You might not want to give up the status or the security or the benefits. Anyway, you invite any part that has an opinion to come on one side of the table, and then you ask other parts who do want to leave your job or find a new job, like, what is their thoughts? Well, I'm bored. I'm feeling like I'm selling out at work. I'm ready for a change. I'm burned out. I feel like I'm not really living my most authentic life. I'd like more creativity. These could all be different parts. So it's sort of like a pros and cons list, but by really acknowledging those parts as little beings inside. And then again, you're not just having them duke it out. There's this wise, mature self that sits at the head of the table and is really acknowledging and listening to, getting to know and getting to understand all parts. So you can say to your parts, like, I hear you, I get you. That makes sense. Thank you. I will take that under advisement. But the real shift comes when we can actually help our parts understand that we in self can make better decisions, that we can be informed by those parts without letting each of those parts like fight for dominance in the system, that we can listen, we can get to know those parts, we can take their advice or not, we can listen to their advice, we can value and validate the positions that they take without necessarily letting them hijack the bus and go careening off the off the side of the cliff, making reckless decisions or decisions that are maybe too restrictive, not reckless enough, not risk taking enough. So that's one way that this can really help us, especially when we're thinking about medical conditions, trying to make decisions about our health and things like that. So, I want to go into a little bit more about how the internal family systems model works. If you're not familiar with IFS, let me try to explain it. So, our parts tend to fall into two main categories: protector parts and vulnerable exiles or wounded parts. So the protectors are further subdivided into two categories. Manager parts are preventive and preemptive. They're trying to fend off danger, and they're kind of the first line of defense to keep you from feeling the intense and painful feelings of your vulnerable, wounded, exiled parts. The parts that your protectors might have pushed down into inner basements and tried to suppress. Another type of protector part are the firefighters or your reactive parts. And these tend to be the parts that we might demonize or dislike or be frightened of. They are the second line of protection in case your managers fail to keep the flames of emotion from flaring up. So the managers are kind of like, they're just trying to keep things safe, make sure people like you, make sure you're paying the bills, make sure you're sort of managing your responsibilities and things like that. But they're also trying to make sure that you don't feel those intense feelings of the wounded parts. But sometimes something happens and, somebody will get close to one of those wounded parts, or something will trigger you or activate you in the moment, and you'll feel those emotions starting to rise or feel the pain that those exiled parts are carrying. In other words, if the managers do their job well, then those wounded parts stay hidden far in the basements of your psyche, and you're not really feeling much. You're kind of going around your busy, chaotic life, and emotions are kept at bay. And usually you don't even know that those wounded parts are there, but they do kind of leak out. And you may wonder why your life isn't working out so well. Why are you struggling in relationships? Why are you having a hard time at work? Why are you dealing with one chronic illness after another? And then some triggering event will happen in real time, or some activating person can swoop in and accidentally get too close to one of your wounded parts. You might go through a breakup, or you might feel shamed by your boss, or you might be publicly humiliated. And then a firefighter part could show up to try to make sure that you don't feel whatever those wounded parts are feeling and like have a meltdown in public. So they use the term firefighter, like they come out guns blaring, like the flames of emotion are rising, and those reactive parts have got a fire hose to try to just wipe out those flames no matter what the impact, right? The people who are carrying the fire hoses, they don't care if the fire hoses damage the shrubbery. They care about getting the fires out. And that's kind of how our firefighter parts are. They might rage and dissociate. They might put you to sleep. They might make you run away from a relationship. They might cause you to engage in some sort of self-destructive or other destructive behavior. They might cause you to indulge in addiction in order to make sure that you don't feel what hurts and numb you out. And they may even make you think about harming yourself. So you're probably pretty familiar with the first kind of protector part, the manager parts, or the preventive, proactive parts that are trying to keep you safe. These are these are the parts that are busily trying to actively ward off danger. And they often get their jobs when they're very young, and they're often very tired. They're working very hard. These parts try very hard to make us socially acceptable, even if other parts might not like them all of the time. So these are the voices in your head that start chattering away if you sit down to meditate. Think planner parts, inner critic parts, outer critic parts that criticize other people, perfectionistic parts that are trying to keep you from making a mistake or being embarrassed, worrywart parts that are just always obsessing about what could go wrong, helicopter parent parts, timekeeper parts that are like, look at your list, financial manager parts that are in charge of your bank account, rigidly rule following parts that are like, follow the rules, be a good girl, be a good boy, catastrophizing, like worst case scenario parts that just go into the like, oh my gosh, if I take this risk, I'm going to wind up homeless under a bridge in a box. Health nut parts that are maybe like worried about your weight, thinking about your health, managing your diet. Busyaholic parts that are just like keep you busy so you don't feel anything. People pleasing parts that might, you know, push other parts down or sacrifice authenticity in order to look however you think might be accommodating to others or pleasant, um, even if it's fake. Caretaking parts that are, busy taking care of your children, taking care of your spouse, taking care of your patients or clients, taking care of the people at the church or wherever. Control freak parts that are really sort of obsessive, compulsive. And you kind of get the picture. Managers are always trying to distract you from looking deeper inside yourself by just chattering away 24/7 about all the things that they think might be unsafe. And again, if you've ever tried meditating and you go inside, there they are. You can you can usually get to know your manager parts just by closing your eyes and just noticing what thoughts start arising in your head. Um, Certainly you might get other parts that arise as well if you do that long enough. But usually in the beginning, if you're a new meditator, you're new to going inside, the managers are often the first ones that are just trying to get your attention again to try to prevent you from feeling. Because when we slow down and we go inside, that's sometimes when we'll start to feel things. So these managers that are trying to distract you, what are they trying to distract you from? And again, remember, the main job of the managers is to distract you from feeling the emotional pain caused by the intense, hard to bear feelings of the wounded exiles inside, the ones that carry painful burdens like feelings of shame, terror, hopelessness, helplessness, powerlessness, worthlessness, unlovability, or feeling defective or damaged. These exiles might carry beliefs like, I'm not enough, or nobody will ever love me. If you're busy rehashing the past or planning the future, worrying about your finances, fantasizing about an ambitious goal, or trying to solve your relationship dramas, then you're probably not so much feeling the intense emotions from childhood wounds that may have never gotten healed. And they can arise anytime you slow down and start feeling. If your managers are very busy thinking, planning, controlling, micromanaging, complying with other people's wishes, you'll likely be so distracted that you might not really feel all the pain that those exiles carry. But the pain is still there. Managers often serve as shaming voices that attack and judge you for what your sometimes reckless or bad habit firefighters might do. Like, think inner critic parts judging all of the parts that you might make New Year's resolutions against. In this way, manager parts try to control the firefighters, the more extreme kinds of protectors who are the second layer of defense and who often act out with behaviors that you may feel ashamed to look at in yourself. It's easy for us to kind of deny our firefighters or just not really pay attention to them or not admit that they're there. So that way, those behaviors, we try to hide them from new friends or lovers during honeymoon periods. We try to hide them from ourselves, but they leak out. We kind of our parts know that these other parts are in there, and our managers tend to judge or criticize or humiliate or try to put a lid on the firefighter parts. So these managers work really hard covering up your true authenticity, trying to force you to wear masks, to conform to the expectation of others, to pretend to be perfect, to, to pretend to be stronger or smarter or healthier or more spiritual or more put together than you really are. And the biggest fear of most protectors is that these wounded exiled parts will flood you with painful emotions and you'll get overwhelmed and fail to function the way that you need to. So they work really hard trying to protect you from getting taken out by these traumatized parts that hurt inside. And we really have to appreciate them. This is one of the big moves of internal family systems is instead of having judgments or shaming or trying to cover up or pretend that they don't exist. The move is really to just get curious about these parts and to try to appreciate them, to find out why they do what they do, so that we can understand the role that they play and begin to show some gratitude for them even if they're also doing things that might be self-destructive or destructive to others. So if managers are the proactive parts, again, firefighters are the reactive ones. They are the ones that are coming online as emergency backup if the managers fail to keep you safe from the painful feelings that might take you out. So in our mainstream culture, the firefighter parts tend to get demonized, medicated, imprisoned, hospitalized, sent to rehab, or otherwise shamed as, bad behavior. So think addict parts, raging parts, rebel parts, eating disorder parts, abuser parts, binging parts, dissociative parts, sociopathic parts, narcissistic parts, narcoleptic parts, psychotic parts, parts that might make you sick, parts that engage in criminal behaviors such as sex offender parts or stealing parts, and at the most extreme end, even suicidal parts. In other words, pretty much everything in the psychiatric DSM-5, the Diagnostic and Statistical Manual of Mental Disorders created by the American Psychiatric Association as a way to label, diagnose, and standardize treatment for psychiatric disorders. But it's not just psychiatric illnesses. Firefighter parts can also show up around physical illnesses, or other parts can use the body or some physical vulnerability in your system to take you out. Think migraines, back pain, chronic fatigue, asthma, accident-prone parts, or even parts that might need you to get cancer in order to slow down and stop caretaking everybody else, to stop saying yes when you really mean no, or accommodating and people pleasing to such an extreme that you actually need, or these parts might need the body to have a really good excuse to stop those extreme caregiving behaviors. For example, that's a common constellation around some chronic illnesses and illnesses like cancer. And again, I'm not suggesting that these kinds of illnesses are purely the result of trauma. Some illnesses obviously are caused by, living next to a toxic waste dump, or your body's self-healing mechanisms simply not being able to keep up with fighting the toxic burdens in your food, or having genetic predispositions to certain things, or being exposed to things in the environment. But according to the internal family systems model, your protector parts might pull out all the stops and use your physical body to try to protect you. And when I say protect you, I mean they're sincerely trying to help you get core needs met. They're trying to give you a really good reason to maybe say no, to be able to have good boundaries with people who are crossing your boundaries, to help you get away from a job that makes you feel like you're selling your soul, or give you a really legitimate excuse for not engaging in certain responsibilities that are like sincerely too much for some of your parts. But also, they might be, by giving you physical symptoms, that can be another way to prevent you from getting too close to those traumatized exiles inside. If you're starting to feel those feelings come up, then you get a migraine. Now you're fixated on the pain in your head. You're not feeling the feelings, you're feeling the pain. So, and this is complicated, and I teach at great length about this, and I've written about this in my book Mind Over Medicine, and in another book I wrote called Sacred Medicine. So, as a physician interested in interdisciplinary cross pollinations of healing, this for me is where IFS really made me take notice, especially after I saw IFS founder Dick Schwartz using IFS with a woman who had a migraine. And she literally had instantaneous relief from her migraine after healing the exile that it was protecting in a demonstration that he was doing in an IFS workshop. So, why would parts that think they're protecting you pull such potentially harmful stunts? Why would they use anorexia or an addiction or cutting behavior or dissociation or psychosis or even cancer? Because they know not what they do. They're autonomous little beings. And until you really get to know them and get a handle on them, until you can really get to understand honestly why they think they're protecting you and helping you, even if they're appearing to be harming you, all of them, according to the IFS model, at their core, they have good intentions for you. And the IFS point of view is consistent with that of Gabor Mate, who spent much of his career working with people who had addict parts. In his book, In the Realm of Hungry Ghosts, he makes the case that most people with any kind of addiction develop these addictions for a very good reason. And demonizing the addiction only strengthens it, while befriending it and becoming intimate with why it arose and getting treatment for the traumas that cause addiction can help loosen addiction's grip. So, in the same way, getting to know your firefighters and the firefighter parts of your loved ones, which can really help in your relationships, requires opening your heart and extending those 8 C's of self, being curious, being compassionate, having confidence, having calmness, and really getting clarity on why those parts think they're protecting you. So if you slow down and you start spending more time in your inner world, and you can do this with your own kind of IFS meditation practice. There are a lot of IFS meditations out there online, and or you can do this in therapy with an IFS therapist if you have the privilege of being able to find and afford one-on-one treatment. But if you take the time to get to know these parts and you become intimate with them, then even the most extreme firefighters will tell you why they think they're helping and which exiles they're protecting. So keep in mind that firefighters tend to use extreme behaviors because at one point in your life, these behaviors were needed to help you survive. And although the usefulness of the coping mechanism may have passed its expiration date, and now it's causing problems, whereas in the past it might have helped you survive. The only way these firefighters get to sort of start calming their extreme behaviors is to love and understand them first. If you're bullying and shaming and demonizing or trying to control your firefighters with manager parts that are, you know, really having negative interactions with them in this kind of bullying sort of way, it typically doesn't help to change the behaviors in a long-term way. And it may even make them act out more. Now, that isn't always the case. Sometimes our managers are very disciplined, and we might go to a 12-step meeting and we learn how to work through the 12 steps, and we get a sponsor or we have a sponsee, and we're disciplining those firefighter parts, by going through that kind of process. But from the IFS model, again, not to say anything negative about 12-step, it's helped so many people. But from the IFS model, what works even better than disciplining and sort of harshly keeping in control those firefighter parts is really extending compassion to them, extending appreciation to them, getting to know why they behave the way they behave, and really bringing that self energy into relationship with them. So what does help is getting curious about these parts, spending time with them in your inner world, getting to know what they need from you and how they're helping you get core needs met, really becoming intimate with them. Once they start to trust you, they might actually allow the exiled or wounded parts that they're protecting to be seen and known by you so that the hurting parts can receive help and healing. And often we figure out what those parts are by asking, what are those parts afraid would happen if they stopped doing what they were doing? What is your inner critic afraid would happen if it stopped criticizing you so much? What are your addict parts afraid would happen if they stopped trying to numb you in this way? And then and only then will those firefighters begin to back down and stop acting out their extreme behaviors. As Dick Schwartz says, IFS therapists and those of us who practice IFS, we are hope merchants for hopeless parts who are exhausted from trying to avoid unbearable feelings. So once those wounded parts that are protected by the firefighters get healing, then the firefighter parts can get reassigned to new jobs within the system. When this happens, the gifts that they carry come through, and we'll find that liberating those beautiful qualities from relaxing our manager parts, relaxing our firefighter parts, relaxing those protector parts, and helping them get new jobs in the system. Because now yourself is going to be here to be with these wounded parts, can lead to a happier, lighter, and more functional life. And as a side effect, sometimes diseases can actually begin to reverse. The symptoms might get better. And in the most impressive or hopeful cases, sometimes symptoms can go away all the way when we're able to work with the parts that might be needing the body to act out in these sort of firefighter ways. So let's talk a little bit about the wounded parts. Who are all of these protectors trying to guard from your own awareness? The protectors, remember, they're like the jail keepers for these imprisoned wounded parts, the inner children that have been locked away, the tender, young, helpless, hopeless, despairing, vulnerable parts that didn't get their core needs met at critical times in your childhood development or at times in adulthood as well. As described in the Internal Family Systems Skills Training Manual, which I highly recommend, when children feel shamed, often but not exclusively interpersonally, vulnerable young parts are particularly liable to develop overwhelmingly threatening beliefs like I'm unlovable and I'm worthless. Equally, when they experience terrifying and beyond our capacity to tolerate feelings, our most vulnerable parts feel stripped of significance. Protectors step in to keep their toxic beliefs out of consciousness. And as a result, vulnerable parts end up permanently alone, forgotten, and often trapped in the past. They long for help, but when they push into consciousness with negative feelings, beliefs, sensations, and memories, protectors again experience them as a hazard. No matter how idyllic you think your childhood was, we all have exiles who may come to conclusions like, I'm not good enough. And then managers come in to develop strategies like, well, then I'll throw myself under the bus to prioritize everybody else's needs so that I don't get abandoned because I'm so worthless. Even if by some miracle you escaped all situational and developmental trauma in your younger life, then most of us have exiled parts that develop even in adulthood. For example, when you get married and settle down to have children, you may develop neo exiles by locking away parts of you that you might think don't belong in you as a parent or a spouse. Like your more, carousing parts, or the parts that have a potty mouth, or more daredevil adventure parts. So no one is exempt from the burdens that these wounded exiles carry. Our exiles might have different stories and different wounding, but they tend to have the same painful feelings: worthlessness, unlovability, not enoughness, shame, feeling damaged or broken or disposable or fundamentally flawed. Because some of your protector parts might not like the feelings that these exiled parts evoke, they will often unwittingly exacerbate the problems, locking these exiles in a kind of inner prison. So they're crying and screaming and begging for your attention all the time. The more traumatic the wounding, the more the exiles will pull out all the stops to get your attention. So the more powerful the protectors must become, ramping up their extreme behaviors over time. The manager parts might be able to keep things under control for a while, but over time, as the exiles get more unruly and the managers fail to keep the exiles under wraps, the firefighters might need to work harder to protect you from feeling where these exiles' feelings are leaking through. So often you'll feel these exiles most painfully in your most intimate relationships, where the exiles will tend to attach to a spouse or a best friend as a way to try to get the needs met the way they didn't get those needs met at some point, usually in early childhood. So you might seek to find that perfect partner or that perfect spiritual teacher or the perfect whoever, the perfect replacement parent, so that that person can function as your redeemer, the one that your parts will want to take away your pain forever. That you may have these sort of unrealistic expectations that those redeemers will then always be kind, always be compassionate, always be loving, always give you a hall pass if you do something wrong. And if this happens, then, these exiles will have a tendency to choose partners and close friends and then burden them with the pressure to make those parts feel better. But inevitably, all human beings, no matter how perfect you might hope they all have their own parts. And when we blend with our own parts, we ultimately are going to let down someone else's parts. And that's why the magic of IFS is that our parts then attach. We repair those attachment wounds and we attach self to parts rather than parts to another person who might then, let them down, to make them more vulnerable, to harm them. So it's in relationships, they say parts that are harmed in relationship must heal in relationship. In IFS, the primary relationship is self with parts. And then you can help other people get to know your parts so they can be your secondary caretakers, or the secondary relationship. So self to parts, and then yourself and parts to the self and parts of someone else. So the problem with the fact that our exiles are in charge of our attachments and kind of picking who we want to be close to is that if your exiles choose your partner and they're dependent on somebody else to get their needs met, they can become very needy and graspy, which can actually cause the other person's protectors to run screaming in the other direction because they feel the desperation of these wounded parts and they may feel overwhelmed, causing those young parts to cry even harder in their inner prisons. Or you might activate a caretaker part, a protector in the other person, in a partner, who might be able to soothe those exiled parts temporarily until your partner ultimately gets depleted and resentful from too much caregiving. And then another protector in your partner may cause your partner to pull away or abandon you, causing hurt for those exiles. So, since you are the only one who can really heal your own exiles, this desperate search for a redeemer can lead to one agonizing disappointment or betrayer for trauma survivors, or one abandonment after another, further burdening your exiles, further causing heartbreak. and ramping up the behaviors of your protectors and sometimes of the protectors of a partner. So, as you can imagine, all this vigilance, this complicated system that works so hard to keep your feelings in lockdown really can drain you energetically. It can activate chronic repetitive stress responses in your body. It can interfere with your body's capacity to heal itself. It can cause chronic inflammation in the body, which has been linked to almost every medical condition. It can impair your immune system. It can impact the microbiome. It can impact how your genes are expressed in proteins in the body. All of this impedes the natural, healthy flow of life force through your physical, mental, emotional, and spiritual bodies. And this also can put you at risk of physical and mental illness. So, what's the solution? What heals the exiles so the protectors can quit working so hard and the exiles can finally get their needs met in a healthy way rather than burdening other people with the excessive neediness of those really wounded, hurt parts? So, there are two bits of very good news. The first is that, as we already sort of suggested, you are the one you've been waiting for. You already have all that you need to be the most powerful healer, the caregiver, the parent, the therapist, the teacher, the redeemer for your own exiles, which can free up your protectors from all their excessive vigilance. And it can free up the other people in your life from having to try to be that redeemer for your own exiles. Mostly, what your exiles want is your love, your attentiveness, your care, your nurturing, your understanding, your compassionate witnessing. They want you to listen to how much pain they've experienced rather than allowing your protectors to kind of try to suppress all of that. They want you to remember what happened to them and acknowledge it rather than pushing their memories, their feelings, and negative core beliefs away. They want an ally, not a jailkeeper, but they may have trouble getting through to you because the two lines of protection, your managers and your firefighters, they do their very best to keep you from even remembering or feeling or being present with these sweet, tender, hurting exiles. Fortunately, the solution is far simpler than anyone might even imagine. The second piece of good news is that when exiles are healed and liberated from their prisons inside, they bring out in you valuable qualities that may have gotten exiled along with those parts, such as the magical child with all of its playful, curious, wonder filled vitality, or the muse with all of her imagination and creativity. So, we think of these parts as so difficult, they cause all these problems, and yet all of our parts ultimately in their natural state, they have all these wonderful qualities that get sort of um, tamped down because of all of the burdens that both our protectors and our exiles can carry a lot of burdens, but especially the exiles. So, unburdening the exiles not only liberates a lot of stuck energy, it also frees up those exuberant qualities that can make you more attractive, more magnetic, more energized, and optimally more healthy. And this is why when I saw Dick Schwartz doing unburdenings in the first in the beginning of my research for sacred medicine for the 10 years that I spent traveling the world working with shamans in Peru and qigong masters from China and kahunas in Hawaii and energy healers in the US, and then ultimately it led me down the path of working with all of these various trauma therapists all over the world. I said, "Oh my gosh, Dick, this is energy healing." And he was like, "Shh, we want to keep it mainstream. We don't want to use that kind of um, that woo kind of language because there's really nothing woo or new age about internal family systems. It's an evidence-based model, and it is, a very effective trauma healing model, but it is also in a way very similar to some of the shamanic practices or some of the energy healing practices that I witnessed around the world from various traditions. All right. So I want to talk about unburdening the exiles because if there's a goal in IFS, the goal is to relax the protectors, earn the trust of those protector parts, get protector permission so that we can go to those burdened exiles, unburden those exiles, bring the protectors back in so that we can show them that that these really hurt, wounded parts are not carrying such strong, painful feelings. And then the protectors can relax on their protective behaviors. So let's talk about that. What does it mean? what is the unburdening process? So I'm going to walk you sort of step by step through how this works. We're not going to actually do it today. We're just going to be sort of talking about it so I can educate your intellectual parts or your learning parts, your therapist parts, your parts that like to understand things cognitively. So step one is relax and earn the trust of protector parts. Managers and firefighters, including those that might be wounded themselves or burdened themselves, usually do not want unburdening of the exiles to happen. So they are sort of invested in preventing the process. So one of the core tenets of internal family systems is we do not override protectors. We do not go to the exiles without protectors' permission. And if you've ever been to sort of workshops or some of these large group awareness trainings or um, kind of therapy groups, you may see that people who are not informed about IFS and the idea of getting protector permission, they may go straight to inner child work, or they may go straight to those exiles without acknowledging all of the parts that might not want you to do that. And that often can cause backlash. We go to these like, you know, growth workshops, and then 3 days after we come back from the workshop, we're like, wow, why am I binge drinking? Or why am I suddenly having suicidal thoughts? Why can I not get out of bed? Why am I being paranoid? So we want to be really careful to do this safely, and that includes step one, relaxing and earning the trust of protector parts. So the only thing that really works is to approach these protectors inside and find out what scares them, discover why they think they're protecting us, really get to understand so that we can have compassion for what is the value that they think they're bringing. They may be causing harm in some ways, but because they're their own little unique beings, they really do think they're protecting you in some way. So our job is to get to know the protectors in this way, to understand why they behave the way they do, even if those behaviors might be sabotaging your health, your relationships, your safety, other people's health. So we ask the protectors what we call the 6 F's of IFS. They stand for find, focus, flesh out, feel towards, befriend. The friend is the F, and fears. So find. First, we find the protector in, on, or around your body. This will be we call it a trailhead to explore. So if early developmental trauma has been severe and maybe you live in a state of chronic disembodiment or disassociation, you may find the part that it's not in your body. It may be somewhere in the vicinity of your body. It may be outside of your body. You may not be able to feel that part in your body. And sometimes other somatic embodiment practices or somatic healing methods might be needed before moving on. Or you can try working with that part that keeps you out of your body or dissociates you as a protector part. Next, you focus. You focus on the part in your body. So, inhabiting your self energy, just really bringing in that wise, mature self, you would turn your attention to the part and let it know that you're with it and that you feel curious about how it thinks it's protecting you. And then you would flesh it out. What does this protector look like, feel like, smell like, sound like? What emotions does it carry? Does it have an image or a name or an age? Is there kind of a flashback? Are you in a scene? Are you remembering a memory? And the key is you want to be able to get close to these parts without blending with them. So if you're with this part, how close will it let you get? And then you want to assess how you feel towards it. This is your compass for assessing how much self energy is present. If you, for example, if you feel like, I don't like this part, then that's another part. You want to find the part that doesn't like it and ask it to step aside. This happens commonly when we're dealing with health issues, for example. So let's say there's a part that might be involved in a medical symptom. If we start working with that part, then other parts might be like, oh, I don't like that. I don't like that part because it gives me migraines or it makes my asthma act up. So that would be another part. And we want to get those parts, get those parts to step aside, or we might have to work with the parts that don't like those parts first. So yourself can be curious about any part without judgment, but some parts might polarize with other parts. So you just want to make sure to protect the part that is revealing itself to you, the part you're trying to work with, from other parts that might attack it or judge it or demonize it or pathologize it. And once any polarized parts step aside, then you can check in with how you feel towards the part now. And if all of your parts are reasonably relaxed, then you'll feel one or more of the 8 C's of self. You'll feel curious. You'll feel you'll feel sorry for it. You'll feel compassion. You'll feel more clarity, more calmness or confidence or connection, courage and creativity. Often curiosity is the first one. We feel curious about this part. I wonder why it does what it does, especially if it's causing harm in some way. I wonder why it does this thing. And then you want to befriend the protector part by getting curious and finding out more about it. You can engage in a series of inquiries to earn the trust of this part as part of the befriending process. So these are some of the questions that you might want to ask to get to know your protectors. If just again, making sure self is there when you're questioning these parts. You can ask, how did this part get its job? How effective does it feel? Does it feel like it's doing a good job? Is is it happy about doing this job? If it didn't have to do this job, then what would it do instead? Because a lot of times our protectors are scared that they're going to be banished from the system, that especially if you've been involved in spiritual communities that might demonize the ego and say, the ego is a pig, you have to kill it. The ego is bad, you have to, get rid of it. Our parts are, our ego is just a constellation of parts. So some of our parts are really scared from those teachings. They think we're going to kill them. But we're not. All parts get to stay, but they often want to be reassigned once once the exiles that they protect are unburdened. So we can ask it, if it didn't have to do this job, what would it do instead? And you can ask, how old is this part? And oftentimes they're very young. And how old does it think you are? Because often it thinks you're just barely older than the age of the part. It often thinks you're much younger than you are now. So you can update it. Let it know, like, how old you are. You're a wise, mature adult, um, unless you're a child watching this. But how old does it think you are? How old are you now? And what does it want you to know? How does it think it's protecting you? What is the value that it thinks that it's bringing to you? What what needs is it helping you get met? And what does it want for you? Because they want good things for you, these parts. And then sort of the mother lode question is, ask this part what it fears. What is it afraid would happen if it quit doing this protective role? And often the answer to this last question will reveal an exile, a wounded part, a vulnerable part. And usually the biggest fear of the protectors is that the extreme emotions of the wounded part will flood the system and make you incapable of functioning. That's their biggest fear, that you'll just be overwhelmed, that you'll start crying and you'll never stop crying, that you'll fall into a pit. You won't be able to take care of your kids. You won't be able to go to your job. You won't be able to get out of bed in the morning. They fear that if you actually came face to face with the burdens that those exiles carry, with all those feelings of shame, worthlessness, helplessness, terror, powerlessness, grief, sadness, that you'd just dissolve into a puddle and you'd never recover. When a part reveals what it's afraid would happen if it stopped doing what it does, then we allow the self to validate that it makes sense. It makes sense why it's been doing what it's been doing for so long. We may even feel moved to thank this part for working so hard for so long to keep us safe. So we notice when we're showing up in self and we're validating those protectors, like, oh, that makes sense. I see how that's been helping. Thank you for helping us survive. So usually our protectors are exhausted. Our managers are so tired, and they feel grateful and open-hearted when they are acknowledged and appreciated for their hard work. Even parts like inner critic parts, they're grateful. It's like, oh, you're trying to prevent me from getting humiliated, from making a fool of myself. You're criticizing me so that I don't get embarrassed. Thank you. And sometimes I let my managers know that I'm not only I'm not going to fire them, I'm going to give them a raise and a bonus, but I'm also going to give them a sabbatical so they can take some much needed time off. Firefighters, on the other hand, they are so often used to being bullied and shamed by other parts or by people on the outside. And it feels like an amazing relief to them to get some love and understanding for why we do what we do, even if our firefighters' behavior might hurt us or hurt other relationships or even behave abusively and really hurt people. So my therapist says we cannot love our firefighters enough. And she held a support group for people showing up as our firefighters. So we can be like, hi, I'm here as my addict part, or I'm here as my raging part, or I'm here as my dissociative part, or I'm here as my eating disordered part. And we can kind of love each other up, love up our firefighters, really get to know them without indulging them. We don't have to indulge them in order to love them. So when your protectors realize that you're not going to shame them or bully them or demonize them or try to get rid of them or otherwise, force them with the force of whatever, the force of doctors shaming you or the force of rehab bullying you or the force of, you know, jail keepers locking you up or lawyers putting you in jail or whatever. Um, when they realize that you're not going to force them to stop doing what they're doing, then we can become those hope merchants for hopeless parts as self to parts. And we simply let them know that self can heal the exiles, and then the protectors do not have to work so hard. We reassure them that the self can do a better job helping to make sure that the exiles don't overwhelm the system. And we let them know that nobody is going to make them leave, that they can stay in our internal family systems. They can get reassigned to do better jobs that they like better. And it's so cute when we give them the chance to find other jobs. They're often so creative. They often want to do something related, but like in a much more positive way. So we earn their trust and we try to relax their hold on us and comfort them and let them know that we're grateful for how hard they've tried to keep us safe. And we reassure them that no one is going to force them to change. We promise them that we will not let bullying managers try to discipline them into doing better, that self, if discipline is needed, self can do that and can do it much more gently. And we tell them that their cooperation is purely voluntary, and we will not approach the exiles until they all say yes. So that's the most important thing. Again, we do not go to exiles without protector permission. And sometimes that means working for months with a whole constellation of protectors that may all protect one exile. So we have a tendency, sometimes we have parts that try to push us to go fast because we want to get healed, we want to be done, we want to get better, or those parts do. But the safest, most effective way is to work with all the protectors first until they're really on board and they're really developing some trust in self, that the self can then go in and heal the exile. And I often think of my friend Karen Drucker, who's an amazing musician. There's a line in one of her songs that says, "I will only go as fast as the slowest part of me feels safe to go." And that really is very IFS informed. So if we do not do that, if we do not systematically make sure that all our protectors are consensual before proceeding with the next step, then we might get backlash. And that means kind of firefighters that can pull out more stops to punish us for going to those exiles that we didn't get full permission to approach and heal. So if you find yourself in an unburdening and maybe you've gone through an unburdening and then a few days later you're acting out in extreme ways, that probably means there were some firefighters that did not give permission. You have to go back and work with those firefighters. So then step two, this is the real beginning of the unburdening, because now this is the witness. This is witnessing what the wounded part, witnessing what the exile went through. Unburdening always begins by making sure that all the protector parts give consent for the unburdening, and self does not proceed until that has happened. But once the exile has made itself known and the protectors have said it's okay, then the self approaches the wounded part with at least curiosity, if not compassion, and all those other 8 C's of self. If anything other than these kinds of loving qualities emerge, then that's likely another protector part, and it needs to be addressed before moving on or going back to step one. This working with the protectors, if you watch IFS therapists working with clients doing this, it's quite beautiful. Their role is to kind of be parts spotters. And if we're approaching an exile and another part comes in and is intellectualizing, or another part comes in, and we say, oh, that's another part. And then we work with that part or ask it to step aside if it's willing. And then the self then negotiates with the exile to make sure that the exile agrees not to flood the system with more emotion than the nervous system can handle. And exiles are, negotiable in this way. Our parts are so terrified that we're just going to flood the system with these exiles. But if we go to them and we say, you know what, would you be willing to only bring 20% of the emotion today? Then they're often happy to try to agree to these terms because they're just so grateful to be getting let out of their inner prisons, to get some attention, to be seen and heard and attuned to and witnessed and let out of those inner prisons. So, assuming that the exile agrees to these terms, then self then witnesses what the exile went through, listening or watching as the exile shares imagery, emotions, beliefs, sensations in the body, flashbacks, memories, whatever else the exile wants self to witness. And the way we do this is we say, so tell me what happened. Show me what happened. Let me feel the emotions. Let me experience in a way. We're not reliving, we're witnessing. So there's some space. Self is there with the exile. We don't want to relive the memory because that just repatterns the neural pathways and starts to hardwire those neural pathways. Instead, we're witnessing, we're opening up those neural pathways to make them labile so that we can go through the unburdening process. But we're not reliving, we're witnessing. As all of this is happening, the self keeps checking in with the parts to make sure that the pace is slow enough. So we'll check with the protectors, is this okay? Check with the exile, is this amount of emotion okay? And we're trying to make sure that the nervous system can stay as regulated as possible and feel safe from flooding. And when you're with a therapist or someone else who's capable of helping to facilitate this, then it's often that co-regulation from someone else who's holding self while you're in self holding the exile. And then the self then validates, reassures, and lets the exile know that the self is getting this, that it makes sense, that you're validating. I believe you. Yeah, I'm so sorry that happened. You're comforting and co-regulating and calming the exiled part as it needs, giving that wounded part a new experience. So you've opened up that neural pathway. And now you're giving that part compassion. You're showing up, you're saying that makes sense. I believe you, I validate you. Because so often these wounded parts have been invalidated, they've been gaslit, they've been um, rejected, they've been abandoned, they've been ignored. Nobody was there at the time to say, I get it. That makes sense that you're feeling what you're feeling. So by doing that, we're giving that part an utterly different repatterning, an utterly different experience than the painful experience that it originally had. Because so often the trauma is not only the thing that happened, it's the fact that we were often so alone and we didn't have the right support to help us get through this. So, neurologically, neurochemically, neurobiologically, this is when neural pathways are labile and old memories can be overridden with new, more positive ones, rewiring the neural pathways through neuroplasticity, which means that the brain, the nervous system, it can all be changed. So, just, even though these traumas live in our nervous systems, they can actually be shifted through neuroplasticity. And this doesn't mean that the memory goes away, but it means it starts to neutralize the memory so that we can actually revisit the past memory without getting flooded with all of those painful feelings, memories, sensations, and beliefs, those burdens that those exiles carry. So, whenever it seems that the exile is done, the self keeps asking, is there anything else? Is there anything else you want me to know? Tell me more. What else? And at some point, that wounded part feels complete. And the self can then say, I really get what you've been through. Are you complete? And the exile will express completion. And the exile is then invited to experience what's called the redo in the inner world. So step 3 is the redo. When the exile has shown you everything it wants to, then self offers to enter the scene from the past. So the self is going to go in with the part into the memory And you're going to ask that part, the exile, what should have happened from the point of view of the exile? And you don't think about it. The exile will tell you. It's very specific. And with a kind of active imagination in your inner vision, you will then redo the scene, following orders from the exile and giving this little one what he or she really needed, which didn't happen back then, but it can happen now. And Dick Schwartz says anything goes in the inner world. He has a whole document about the laws of inner physics. And he says that if the exile wants you to get in a fight or kill someone or perform some impossibly heroic act of rescue, then self just goes in and does it. Whatever the exile wants you to do, you go in and you do it. There's no harm in the outer world, in spite of what some spiritual communities might talk to you about manifestation or whatever. There's no harm in the outer world when we redo what the exile needs in the inner world. And you definitely want to make sure that any like spiritual bypassing parts or premature forgiveness or church going parts or whatever, you want to keep them out of the redo. Like, sometimes we'll have other parts that might come in that want to like let the perpetrator off the hook before we've done the unburdening. So you want to have a good boundary against those parts. If there's forgiveness to be had or any of that, that's later. Right now, the exile can be as mad as it wants to be. It can be as sad and hurt. It can want revenge. It doesn't matter. The exile is allowed to feel whatever it feels, and self's job is to protect the exile from any parts that might want to clean up the redo or make excuses for the abuser or the person who's neglected you or whatever. So genuine forgiveness can come after the unburdening of the exile, but not usually mid-process. So sometimes, I mean, these exiles, when they're unburdened, they're incredibly generous. But during the redo, if the exile wants to hate the mother and wants to beat up the father, then go ahead and let it hate and let the self beat up dad. It's okay. So, you might find that if there was the redo might include a contradictory or restorative experience of whatever phase of childhood development might have gotten interrupted. If this is a child part, if it's an adult part, it might need um, to have others present to hold the experience. And self is going to be that primary redeemer again in that place. So maybe the part needs an experience of healthy attunement with the parent in a way that lets the parts get their needs met in the inner world, or perhaps it includes letting the part take more risks or be more assertive. Or perhaps it means letting self set stricter boundaries and offer more safety precautions. So, whatever it is, you just ask the part. The process can be incredibly tender and heart opening as the self reunites with the wounded child parts and not only makes a connection, but in a really loving, intimate, bonded way, the self then offers what that wounded part did not get from the parents or from a spouse or from whatever loved ones maybe weren't able to be there at the time of the trauma. So this can feel just as much like falling in love as we do when we meet a romantic partner. This love between the self and the exile. It's this love that cannot be lost because self and parts never have to part ways, even in death. And in this way, this is where the you are the one you've been waiting for comes through. The self departs bond is often what fills the emptiness that some of our protectors are like trying to fill this void. And this is really the ultimate balm. And so the redo then, because we've opened the neural pathways, we've now made them labile. And the redo now rewrites the neural pathway, which is key to neuroplasticity. And then we go into step 4. So this is retrieving the part from the past. You may have heard of things like soul retrievals from shamanic processes. So there are some similarities in the unburdening to the shamanic soul retrieval. So when the redo is complete and we ask the exile, is that it? Is there anything else you need done? No, they're fine. Then the self can go in and ask the exile if it's ready to get out of that place where it's stuck in time, stuck in the past. It's usually in a very specific scene. And we can take the exile, self can then take the exile someplace peaceful and relaxing. And you can ask, where does it want to go? And it will communicate where it wants to go, real or imaginary, anywhere that it feels safe, held, nurtured, peaceful. I've had exiles that want to go sit on clouds with cherubs in heaven, or sit in the hot springs at Esalen Institute, or swing on the swing sets at the grandmother's house. Anywhere they want to go, you take them there by magic carpet, helicopter, teleportation, however they want to get there. So step 5 is the unburdening. So once the exile is safely settled in its new abode, free from where it was stuck in the past, we can ask the exile, is it ready to be free of all the heavy burdens? Is it ready to let go of those burdens? Is it ready to let go of those painful emotions, those negative core beliefs, those uncomfortable body sensations, those painful memories? And we invite the exile to let go of all that toxicity that has been stuck in the nervous system, stuck in the physical body, stuck in the cells of our body, like literally issues in our tissues, since the original traumatic event lands as a somatic experience. So we can ask the exile then, what would they like to give it up to wind, to water, to fire, to earth, to light, to some other way of letting go? I like to add on elements of advanced integrative therapy, or some of you may be familiar with emotional freedom technique. These are energy psychology techniques that can be useful at this point to clear negative core beliefs energetically from the body. So I often kind of slow this down. This isn't really a part of IFS, but I like to slow this part down and really ask the exiles, like, what beliefs did this part take on because of what happened? Maybe it took on the world isn't safe. I'm not enough. No matter what I do, I'm going to always fail. I'm a sickly person, so I'm always going to be sick no matter what I do. Whatever. What are those beliefs? And we can actually use things like AIT to go through these various chakra points, repeating the statements of the core beliefs through the body to clear them. And then step 6 is inviting in the qualities that didn't get to develop because of this trauma. So again, we might have not developed certain qualities, like maybe we need assertiveness. So we could then use some of these energy psychology techniques to bring in these qualities. And I won't get into the details of how to do that now. In IFS, we just sort of ask the part to unburden, to let go, to like let us know when it's gone to the elements or whatever. And then we invite in new qualities. And again, I like to slow this part down and really, really get clear on what are the qualities that we're inviting in. What are the qualities that didn't develop? What are the qualities that we're now inviting in? And at this part, often you'll feel so much lighter. The exile will be feeling freer. And so now we want to bring in step 7, protector check-in. So once the exile is now safely in its new place, it's unburdened all those burdened beliefs and feelings and sensations and memories. It's installed new qualities and programs. We then ask the protectors, the ones that we had to get permission from. We ask them to come back in and witness, look and see how is the exile doing. Because again, they think that the exile is not going to be okay unless they do their protector thing. So we want them to come back in. And they often will see, wow, this exile is pretty relaxed and sometimes even really blissed out and happy. And so this is how we start to earn trust between the protectors and the self. We can say, look, when self actually goes to these really wounded parts, self can do a better job freeing the exile from its stuck place in the past without overwhelming and flooding the nervous system in a way that makes you, incapable of functioning. And this is really how we start to develop trust. The more unburdenings we do, the more our protectors relax more easily because they're like, oh, I see this has gone well. When self goes into the past and witnesses this experience and goes through this whole unburdening process, wow, the whole system actually feels better. So step 8 is really important, and people sometimes skip this step because you feel so much better after an unburdening. But it's really important to have some discipline around the IFS as a practice, as you can think of it as a kind of spiritual practice, as a healing practice, as an energetic practice. But step 8 is the follow-up. So because we've opened up these neural pathways by witnessing what the exiles have been through, we've opened them up and made them labile. We've made them available for memory reconsolidation, which is the process of making those traumatic pathways labile, opening up the memory, installing a new memory with the redo, and then during that window of time when they're labile, then we want to actually anchor that new neural pathway in, because again, the traumatic pathways, you've often been repeating that memory flashback after flashback, whether consciously or unconsciously as like an emotional flashback. So we now want to build a new neural superhighway. And the way we do that is that we can check in every day for 30 days minimum. We want to make sure every day we go in and we check. I like to close my eyes. We'll go back and we check inside and we see, how's that exile doing? Does it need anything from us today? Is it in the new place still? Is it still doing all right? Or has it gone back into the past? And if they go back into the past, that means probably there's something that didn't get witnessed. We can go back again, witness whatever didn't get witnessed, and complete the unburdening again. Because if we've witnessed everything and it really was a complete unburdening, then every day that we go in, the exile should be doing fine. We can show up lovingly and consistently every day as a sort of inner world check-in. And we can ask, is there anything that part needs from us today? And because often those parts didn't get core needs met. So this is a really loving way of checking in with ourselves. One of the common side effects of trauma is that we lose touch with what we need. And we're focusing maybe on what everybody else needs. And we can't even remember or feel, what do I need today? So it's this loving check-in. What do I need today? What does this part need today? And then we can start to be really gentle in developing trust. And at the same time, this daily check in, asking the part what it needs that day, it helps to ground and secure the healing, to rewire the pathway in the brain, to overwrite it neurologically and start building that new, healthier superhighway. And we can then offer hugs, love, reassurance. Sometimes your part's like, I want juice, a swing on the swing set, whatever that part might need as it integrates into the system and finds its way towards healing, almost as if you're earning the trust of a rescue animal or a foster child that might not know you very well, but really desperately wants to be loved. And this daily check-in then anchors new neural pathways. And hopefully the healing and integration process for that part is then complete, having laid those down, restoring new memories, replacing the traumatic memory with this redo memory, this imaginary memory that, the nervous system can't tell the difference. And the great thing about this, it's so sweet to watch this happen in yourself or to witness it in somebody that you love who's going through this process. But when it does, all of these exiles and the protectors that get to relax, they have natural qualities, natural gifts that get liberated and freed up to bless the system with previously suppressed qualities like imagination, playfulness, creativity, fun-loving qualities, and other beautiful gifts that may have gone underground because of the trauma. So as you watch people go through working with the IFS model to unburden parts, to relax protectors, to really become intimate with all of these partners, they start to become lighter. They actually often look brighter. We start to look less burdened. So, and one of the beautiful things that is possible, it's not a guarantee, and I certainly can't make any false promises around this or give any kind of false hope. But one of the things that I've observed clinically over and over, and many of the IFS therapists that I know, many of the physicians that I've trained as part of my work training physicians, we've seen anecdotally time and time again that when people go through this trauma healing journey, which is a journey, it takes time, it doesn't happen overnight, but over time, often these medical conditions that can develop or these psychiatric conditions that can develop as a result of trauma, they start to get better. The symptoms start to become less significant. People start to have more energy. They start to feel less fatigued. Their immune systems are bolstered. They may also be doing other things, changing their diet. As we work with some of those protectors, we might be indulging in less firefighter behavior. So we might be able to get more of a handle on some of our habits that can impact our health. And we just have more life force. We have more chi or prana, life force, whatever, all the different systems call this something different. But we have that moving through our bodies and we're able to often restore better health. We may not be completely cured. There's a difference between healing and curing, and that's a whole other conversation. But when we heal, then sometimes our illnesses might even be reversed. And my partner, Jeffrey Rediger, and I, both of us, spent collectively about 33 years researching radical remission, spontaneous remissions, they call it in the medical literature. And these spontaneous remissions have been reported for almost every condition you can possibly imagine. The Institute of Noetic Sciences has collected over 3,300 case studies of spontaneous remission, or Kelly Turner called it radical remission. These diseases that were believed to be incurable that were cured. And we don't have data. We don't know. Did they do trauma therapy? Is that part of what helped them get better? We can sort of go back and ask them questions. And my partner Jeff wrote about this in his book, Cured. And I wrote about this in Mind Over Medicine and Sacred Medicine. And Kelly Turner wrote about it in her book, Radical Remission. I recommend all of those books for people who are struggling with medical illness and interested in a trauma-informed approach to some of these things. But the hope of this, and this is why I'm passionate about teaching this, is that if we can help, if we can help help get to know our protectors, we can help unburden our exiles, we can help rewrite those neural pathways, we can liberate some of that stuck energy, we can relax the nervous system so it's not always in a chronic repetitive sympathetic overdrive or dorsal vagal freeze or fawn stress response. We can improve our inflammatory system so that we're not stuck in chronic inflammation. We can activate our immune systems. We can bolster the body's natural self-healing mechanisms. And hopefully we can optimize the body's chance for whatever optimal outcome is available for whatever you're going through. So I thank you for listening to this. I thank you for considering this as an alternative way of thinking about some medical illnesses. I invite you to follow me at lissarankin.com, LISSARANKIN.com. I'm also on Facebook and Instagram. I have a Substack where I write a lot about boundary wounding, about healing your wounded boundaries, about spiritual bypassing, about internal family systems, about trauma healing and recovery. And you can find that at lissarankinmd.substack.com. So please, I look forward to communicating with you and seeing you in some of the online classes that I've been teaching about all of this. So thank you again, and blessings to all of your parts.